Happy Midweek, Glam Squad. Welcome to another episode where we focus on everything glam just for you. This is where your beauty is cherished, your wellness is prioritized, and your heart is treasured. And today we have an informative, educative show for you because we are tackling a health issue that is called GERD. Now, this is a mouthful because the entirety of the word is gastroesophageal reflux disease. And we have Dr. Michael Mochiro, who is a surgeon and interventional endoscopist, who is going to take us through what GERD is and how you can properly find a solution for GERD. So stay tuned because it's going to be a very amazing show. Sit tight and enjoy. Let's go meet him. And here's our star for the day, Dr. Michael Mochiro, who is a surgeon and interventional endoscopist. Hi, Doc. How are you?
I'm fine, thank you. How are you?
I'm great. Thank you so much for having us today as we discuss more about this thing that I can barely pronounce. So we said it's gastroesophageal.
Yes.
Reflux disease.
This is correct.
Got it, Yay. Fantastic.
Also known as GERD. So
Yes.
if you find it hard to say gastroesophageal reflux, you can just say GERD.
Yes.
It's much easier.
Thank you so much. Now, before we get to the sciencey stuff,
Yes.
tell us more about yourself. What do you like to do other than work? Do you have a life other than work?
Yes, this is an interesting question. So I am a surgeon, as you say, and you know, medicine is interesting because you're always putting in a lot of hours, and so for many of us we find other ways of adapting. So in my spare time I read books a lot, and I read everything: journals, medical books, fiction, history, biographies. I've written a book, that is the other thing I like doing, so I write a lot, research papers, but I've also been working on a few manuscripts. And then when I have time, I like exploring, going out, hanging out, and bike riding and those kind of things, just to keep you active. But also, it helps you to put perspective to what you do when you can slow down and just spend some time to appreciate life.
Yes.
Because our life is so busy.
It's so fast.
Yeah. So we look for those opportunities to just say, I'm going to go and watch a movie. So I still go to the cinemas once in a while, take the kids. And watch a movie or two.
Okay.
Yeah.
So one of the things that is really big on the glam is confidence, because a lot of people want to look confident, but not only just looking confident, but truly inherently feel confident. And with something like GERD, this is something that can alter that feeling, yeah? So maybe we could now start with you explaining to us, what is GERD?
Yes. I think it's good you've brought up the issue that GERD can affect your lifestyle, and I think I'm going to interweave that to these discussions. So GERD, by definition, is when you have contents in your stomach coming back up into the food pipe or esophagus, as we call it. It depends if you're British or American, or E. Kenya is inherently British.
Yes.
So many people still say esophagus. So reflux is food contents coming from your stomach up into the food pipe or esophagus, and it causes this discomfort. Okay, so many patients complain about heartburn. They feel like there's this sensation of burning up their food pipe. It can present in many ways. Some patients have this pain that is centrally located, but also moves to the back, sometimes up to the jaw, to the arms. If it gets worse, you can even have patients who complain that they cannot sleep well at night because it wakes them up. And others have bad reflux that even during the day, when they're trying to do their day-to-day activities, they have belching, they have this funny sensation, taste at the back of their mouth. And also, to clarify, sometimes we have this interesting thing called rumination.
Yes.
Rumination is when people bring up food. It's fascinating. So you can learn to do this, to bring up food and chew it again and swallow. And so that's different from regurgitation. So rumination, you can learn to do it. Regurgitation is really contents come back up and they create this sensation. And so the main hallmark of reflux disease is that they have discomfort. They have some of the symptoms we've discussed, and it can culminate with altering their way of life. And that's usually when people now start seeking for help and come asking, I'm having trouble, I cannot, the food I take, every time I take food, it gets worse. Now, I have a child in school, and they're being brought home because they cannot, when they're in school, they keep complaining they're having this funny abdominal pain, and it's, even with the food, sometimes it's vegetables, spices, makes it worse, and it can really affect your ability to do things. And I think the most practical example I can give is now that we're heading to exam period, I've seen many candidates who, as they get closer to the exams, stress is one of the triggers.
Okay.
And so they come with this, they're complaining of reflux and worsening pain. And so, it can actually impair your ability to function and have a normal, day-to-day life.
Yeah. I know you've talked about stress triggering GERD, but what other things would trigger? Are there people who are just predisposed to having GERD, or they're just... What could it be?
Yeah, so many things can play this role. The obvious ones we've said is stress, and stress can be from different sources. Whatever you do, if you're an accountant and you're balancing accounts at the end of the month, if you are a high pressure job like doctors, surgeons, pilots, weight gain has also been associated with this, and we found that there is some association with patients who are overweight and obese and having worsening reflux. There are some foods that can make this worse. Now there are people who like spicy, chili, hot foods that can contribute to this. Alcohol and tobacco are also listed as one of the potential things that can contribute to you having worsening reflux. And depending on how often they do this, it can get even worse. And then the other part that we often talk about is for patients who are having now chronic reflux because of having this for a long time. So there's an entity where if you have this for a long time, it becomes part of their day-to-day activities. Yeah. But really, and then the last one, because you talked about fashion, very tight clothing.
Oh, wow.
Yeah, so if you have tight belts, ladies wear their skirts up here, and that presses on your midsection, that can contribute to worsening of reflux.
Okay. Would you say there's more people suffering from GERD in the recent years as opposed to back then?
I think technology has advanced such that now we are able to diagnose and catch many of these things earlier. Yeah. But that being said, we as a country, and actually not as a country, most of the world has now adapted, and if you remember, we've changed from traditional diet, to now more westernized foods.
Yes.
We now have more patients who are overweight and obese, or more of our population is overweight and obese, and that has contributed towards more people having reflux. Okay. So it's really a reflection in the change in our society that is now leading to more people being affected by this problem. So it's a global problem, not just here. I think many parts of the world, this is one of the things that many doctors have to deal with every day.
Okay. So as a parent, when I first saw what you guys are doing, I thought, okay, I've had friends who have complained that their children have colic, they're not sleeping at night because they have discomfort, and I wondered, is there a relation between GERD and colic?
So I think we go down to the anatomy or how the body is made. Now, when babies are born, of course, everything is tiny and they are growing. But usually, I think I'm going to show you on this, the part that the food goes in, from the food pipe to the stomach, that part where we call the lower esophageal sphincter, is many times still loose. So babies in the early parts of life, when things are still growing, have a loose sphincter, and so they have contents coming up. But then, in addition to that, they also can have the colicky gas disruptions, but they outgrow it. As they grow older and you have more tone getting to this part, they stop having the reflux episodes, and then they move to normal diet, and usually it goes away. Now, reflux is GERD is almost the same, because the components of this is that you have a loose sphincter at the bottom here, and then you have acid reflux coming back up into the food pipe, and because of that there is inflammation of this part. And so inflammation is essentially the acid sort of over time, I think I can say, causes like little burns because of washing on that area, and that irritation causes this problem that now they come with, complaining that they are having this pain that is dull and is at the bottom of their chest. So really, it's all about having a loose mechanism down here that allows contents from the stomach to come back up.
Okay.
Now, the food pipe was not designed to have a lot of acid content. That is really the main problem. Okay, and so when they have that over time, it causes inflammation, and the patients have, they come to seek for help because of that.
Okay. All right. So for the kids, you don't have to, it's not really an emergency per se. It's just something that goes over time as they grow and their organs grow. Okay.
So we manage it, you help mothers to know how to help their babies navigate that period.
Yeah.
And then most babies will outgrow this, and then they go back to their usual, diet, and it goes away. But it's a significant stressor when you're a new mother and you have a baby who is
crying
always
all
crying.
day.
Yes.
100%. Now, Dr. Machiro, you guys have an amazing technology, an FDA-approved technology here in the US, Japan as well, and Europe.
Yes.
Fantastic. And that's what we want to talk about, because you guys have decided you'll reduce a lot of the stress that people are going to try and find solutions to GERD. Why do you think medicines, before we get to the GERD-X, why do you think medicines like reflux medicines, why aren't they working? Despite them being,
available.
Yeah.
I think maybe let's go over how we would manage patients with reflux.
Yes.
Because then that would explain when you would need to use the additional treatment options. So for many patients who come with reflux, the mainstay of treatment is actually medical therapy. And before we go to medical therapy, most doctors you will see will start with what we call lifestyle modifications. So remember the list that we talked about earlier?
Yes.
Many of those things are reversible. You can stop smoking, you can slow down on alcohol, you can, stop wearing tight-fitting clothes, the belts. You can lose weight. So those are things we can actually address. In fact, one of the ways we tell patients who have reflux is simply to elevate the head of the bed. So you get some additional pillows at night when you sleep, or sometimes you can get like a piece of wood, like a few inches. Add that so it lifts the bed, and we find patients are able to better cope with their reflux. The other practical things, like not eating 1 hour or half an hour before you go to sleep. Or some people even eat while they're in bed. They have a midnight snack by the bed. That will make it worse. So we say eat 2 to 3 hours before you go to sleep. And so we try this first. And usually if patients have improvements, we can use that as a mainstay. Now, for many patients, this is not enough, and so we now move them to the next step, which is usually medical therapy. And here we have a few options. We have drugs like the histamine receptor antagonist or the H2 antagonist, and then we have PPIs, and then we also have the newer drugs in the market like the potassium vonoprazan is the actual drug name I was looking for. They work by reducing the amount of acid that your body is able to produce. So for patients who are having significant reflux, multiple episodes in a week, usually we start them on the treatment and then we see how they do. And for many patients, we do around 8 weeks of therapy. We follow them up in clinic, and we start them, on as low dose as possible and maintain them on that. And if they improve, usually we taper it down after the 8 weeks, and then we follow them up in clinic. Now, the next step is for patients who now have persistent or worsening symptoms despite being on therapy, or patients who come with significant, like what I was talking about, chest symptoms. They wake up at night, they are now having cough, they're having chest infections because of worsening reflux. And so for these patients, we now ask, can we do something else? And so we have some additional tests, like before we do that, you can do what is called acid exposure studies. We do pH manometry. If you remember from your chemistry and physics, the pH is a test of how acidic or basic it is. And so you have this nice probe that you swallow, and it goes to the stomach, and it tells us how much exposure to acid you're having. And so this helps us to decide, do you actually have, reflux disease, or is it not? Is it insufficient to be categorized as that? And in these cases, we now have a discussion. So many patients who come have had multiple, treatments, many years of being on these drugs, and they now say, it's now affecting my quality of life, I need something else. And so we now offer them, we can do something about your problem by trying to tighten. So if I go back to this illustration, to tighten this part. Okay. That is the basics of the treatment. So you can do this through laparoscopic or open surgery. And now we have newer techniques that use endoscopic options. So GERD is one of them. There's actually an interesting device which is called the TIF device, transoral incisionless fundoplication, which again goes through the mouth, goes to the stomach, and what it does is it puts some, it closes this space here by pinching on the stomach and makes it tighter. We also have a new device called the Lynx device. Yes. Okay, so the Lynx device is for reflux, and essentially it's like a ring. It's a series of titanium rings that go around this part, and it's placed surgically, and it has a magnet in the middle. And
oh, nice! So it like brings it together.
Exactly. Yeah. So the magnets pull together. There's a little titanium switcher in the middle, and it tightens this place. The beauty of it is when you swallow, they separate. Food goes through, and then it closes again.
Oh wow!
Okay. And then we have the reflux stop. That's another one of the newer devices. And for that, again, it's they implant a device here, laparoscopic, and that also narrows this space. And essentially, the overall functional thing we want to address is the top part of the stomach, which we call the fundus. We make it a little bit snug, okay? And when you do that, it reduces the acid that goes from the stomach to the esophagus. Yes. And so we are now excited to be able to introduce, the GERD device in the country. It's now available. The beauty of this is it avoids you having, the keyhole surgery. We don't have to make holes go in there or open to correct this. So it uses endoscopy. We put you to sleep. Usually it takes around 20-30 minutes. We pass, the device down into the stomach, and then using this system here, and maybe we can talk a little bit about it now. So you can hold it actually. I know you mentioned that, it's like playing video games. Yeah, kind of. So if you do video games, you would do very well in this kind of work. So I have a cool job because I get to use endoscopy devices every day. But so you have the handle over here, and maybe I can have you hold this end, and you can see we have so this is like a joystick. So you hold it like that. This knob here, you can see what it does. Yes, it's moving. It turns it all the way up and straightens it. Why is this important? The part of the stomach that we're trying to fix, the only way to get to it with this device is by looking back on itself. So usually when we're in the stomach... Oh, because you did mention that you have like something here that now shows. So an endoscope goes through this spot. So we pass the endoscope through all the way through this system, and it comes out. You can see there's a small hole here.
Yeah.
It comes out of there, and the endoscope now looks back at the top of the stomach. And then once we do that, so I'm going to straighten it a little bit more. You have these controls here. So usually we start by opening, and I just pump over here. You can see the jaws open. Okay. At the top of the jaws, we have sutures mounted. And so once I'm ready, I mount the sutures and I flex like that to the place that I want to tie. Okay. And then I push out this hook like that. Maybe I can straighten so people can see.
Oh yeah.
You push out the hook, and once the hook goes into the tissues, you turn it a few times, and then you pull the tissues into the jaws. And then all you do is now to move this to the closed position, and you close the sutures into the tissues. Once you do that, I just fire, and when I press fire, I move it to the firing position and I fire. The sutures will fire across, and then I will open like that and release the tissues, pull back, and then we usually straighten and we remove this from the patient. So this comes all the way out. Once it is out, the end result is the part of the stomach that is here that we've now fired. We have narrowed this space.
Yes, yes.
Ultimately, that's what the fundoplication does, because if you're doing it using normal surgery, we usually take the top of the stomach and we wrap it around this part.
Yes.
We put some sutures.
Okay.
So this allows us to replicate that without having to do the laparoscopy or open surgery.
Okay.
Now, it's important to mention that for patients who present with this problem, many times they also have what we call a hiatus hernia. Okay, so a hiatus hernia is right here where the chest and the abdomen, the bottom part of your body. If there's a big gap, usually we close that during a surgical procedure. So this device is usually good for patients who don't have a big hiatus hernia. Okay, it's a bit complex, but it's an important thing to mention, as we have to choose the right patients who would benefit for this procedure. And so we have very big hernias. Those ones probably not good to use this because it will not solve the hiatus hernia. But for many patients who have reflux and a small hiatus hernia, we usually are able to do this. And like the last patient that we were able to help with this procedure, they actually, the patients have done, all of them had significant issues with reflux. They had been treated for many years, and so we were able to offer them very good acid control by tightening the area, that junctional area, using this device. Yes.
I know you've mentioned the benefits of this, yes, but I mean, other than very short, it's it's invasive, but it's also not open surgery. Minimally invasive. Yes. What other benefits would you say this gives a patient who has, like you said, persistent GERD?
Yeah, I think you are able to get back to work, faster than the older methods. So for open surgeries, you'd be in hospital for a few days. For laparoscopic surgery, 1 to 2 days. So for this, now we can do it in the morning, have your procedure, and you go home in the evening. Now, for most people, they would prefer to spend the night and just, make sure we take care of things. And then the other bit is also the cost side, because now we've removed, procedure time. It's a one-day thing. It's a little bit cheaper than if you did it the standard way. But ultimately, I think it's the whole not having to do a surgical procedure. Yes, that we can do this as an outpatient day case procedure, and you can go home. I think it's a very fairly straightforward, simple procedure to do. Of course, with the appropriate preparation and training. And for many patients, the discussions that happen before the procedure are more important than the actual procedure. You know, we talk about the expectations, what will happen after the procedure, the diet they will take after the procedure, and then how we can assist them, you know, with getting back to their usual day-to-day activities.
Okay, which is something we'd also like to know.
Yes.
But before, I know you talked about the interventions before, you know, medical therapy. But what if I have mild symptoms, but I don't want it to persist, you know, because over the years, if you're not changing a lot of things, chances are that it would persist.
Yes.
If I want to just go straight to this technology, would that be something that Dr. Michael Machuro would recommend?
I think that's a really good question. I honestly would say, for many things, that's why we have algorithms in medicine. You know, we have a standard pathway. There are very few patients who would go straight to that. I think if you've never had any treatment, so this is the first time you are seeing a medical practitioner, it's very rare that you'd go straight to having a procedure. I think it's good to be honest and say we would try you on the usual things first. However, there are some scenarios where we could say by the time the patient comes to see us, they've already, you know, had other things. You know, if you've had many surgeries already done, so we know a surgical procedure is not an option, and they're coming now with persistent reflux or infections, you know, chest infections, cough. That kind of patient we may consider going straight to doing the fundoplication procedure. But I think many patients, we would try you on, you know, the lifestyle changes, the medical therapy, and see how you do, and then we offer the additional endoscopic treatments. Because you've raised this topic, I want to flip it to the other side, which is occasionally we have what I call alarm symptoms. Okay. And because many members of the public will be watching this, it's good to talk about this. I always take opportunity to talk about public service announcements. Yeah? Yes, so alarm symptoms is if you have unexplained weight loss. So even if you have reflux, but you have unexplained weight loss, if you have difficulty in swallowing, if you have pain with swallowing, or if you have a family history in your family of somebody who had a cancer of any type, those patients should have an endoscopy procedure. So by the time we prepare to do this, usually we've done an endoscopy procedure to make sure that the stomach, the esophagus, they are all fine. We can do the other tests we talked about, the manometry, to ascertain how much acid exposure time you have. But I think it's important to also highlight that we can catch other things if you have these alarm symptoms. So really, the answer to your question is patients who can go straight to endoscopy are those where we see some of these alarm symptoms. Here in Kenya, believe it or not, we have one of the highest rates of cancer of the esophagus in the world. Kenya, Malawi, Uganda, Tanzania, this part of the world, and it's one of the things we've been trying to understand why that happens. And so in this neck of the woods, I always say, if you have these other symptoms, it's good to have a doctor see you and probably get an endoscopy done to make sure that the symptoms we are thinking is reflux is actually not something else. Reflux pain can also mimic chest pain, which, as you know, could be a heart-related problem. So you see why it's important to have a whole body evaluation as you are trying to help patients decide what is the next best therapy.
Yes. So would you say reflux is mostly a woman thing or a guy thing, or it just affects everyone?
It affects everyone. I think now in clinic, I see pretty much men and women. I say women have better health-seeking behavior than men.
Really?
Yeah, because of many reasons. But that's anecdotal statement, no one should quote. But it affects both men and women. As we said, in Kenya, we are seeing a lot more incidence of obesity, and that is contributing towards this by itself. So really, this, and you know, it's significant enough that it can actually affect, you know, quality of life, as we talked about. So it's almost equal between men and women, right now. So pretty much anyone can have
Okay.
reflux. And so if you do have any of the symptoms that we've talked about, you can reach out and we can be able to have the discussion and see how best to support you.
Yes.
Yes.
You talked about it being cost effective. Is it relatively cost effective, or it's cost effective in the long run, especially for people who are continuously buying medicines over the counter?
Yeah, so it's actually relatively cost effective. I think the question that we have is, right now with healthcare financing models, how do you get to do a procedure? By the time you get to actually do the procedure, so there's the equipment, the implants,
Yes.
the personnel, the infrastructure, and then of course, hospital stay. So all of these factors play in. But for surgery, really the most critical point is usually the implants that are needed to do the particular procedure. And so for this particular case, really what you are getting is just the GARDEX device.
Yes.
Itself, because the endoscopy is a reusable unit. Once you have it, you have it. But for this, we get the system and the switches, and so all you have to do is get the GARDEX system to be available. So I would say it's, compared to what we have currently, it's relatively affordable. I think we've talked about the pros and cons.
Yes.
And the differences between the approaches. What we are really saying is, we now have an option that allows you to get back to, like for you could have a procedure today and tomorrow be back to work, doing what you usually do, as opposed to being out for a few days, recuperating.
Okay.
Yeah.
What would you say is your most memorable story, because you do interact with a lot of people and you've seen people's lives transformed? What's that one story that is still etched in your mind?
I actually have many, but in reference to GERD, because that's what we are talking about today, I think there was one lady who had come to see me, and she's middle-aged and had struggled with reflux for a number of years. I mean, she'd had it for a long time. She had been on medical therapy for a while with no improvement, and it was affecting her to the point that she could not have proper sleep. It was that bad. And so as soon as she heard that the device was available in the country, she came to clinic. We had a discussion, talked about everything, and the whole procedure, what can happen, what happens afterwards, and then we did the procedure. And in post-surgery, she had, it was remarkable to see the difference before and after the procedure. Like now she was saying the reflux, the discomfort she was having, she could now sleep at night. So really, for patients who've struggled with this type of problem, when it's really severe, and you have to do a endoscopic intervention, it makes a big difference to their quality of life. So I think it's a good reminder of how innovation and medicine merge, and how that affects patients' lives. In the day-to-day things, which we never think about when things are working perfectly. You never say, I have a stomach, it's making acid every day.
Wow, I can only imagine as a woman, not sleeping, your cortisol levels are just through the roof. And then, the issues that develop on your face, maybe breakouts. So one of the most important things that I'm also learning on this Glam journey is that taking care of yourself starts from within, because once inside is taken care of, it automatically shows. On the outside, which is something that, I'm also learning to do myself. You will share your contact details, but as a doctor, how are you excited about the innovations that are coming in regards to GERD treatment, and what do you think is the future?
Yeah, in fact, this is, so I like gadgets, if we call it that way. And one of the things that I have enjoyed seeing, especially here in Kenya, is we should be able to offer world-class care in our country. And I think it doesn't matter where you go. Like even if you are in Mombasa, Kisumu, Nairobi, it should be available. So it's been interesting to watch, things like GERD now available in the country. In just the endoscopy space, in the last 10 years, you can pretty much have any procedure that can happen in any part of the world right now in this country. And so I think it's a testament to the growing, training programs, collaborations that have enabled Kenyans to be able to train and to offer this care. But for reflux surgery, I think it's exciting to have the GERD system available, and really to be able to offer patients who would desire to have this type of procedure available, and to offer it through an endoscopic option. And it's really exciting to watch this. And actually the first time when we introduced the system into the country, we combined it with a training session, as we did the procedure. Come closer, like that. So you see, when I'm ready, then open, reach. We were also, learning how can we ensure that as we use this device, that we were learning from world experts and also amongst ourselves, ensuring that we pass on the skills that are there to others. So really innovation, personally for me, is one of the things that I really look for. And I'm always excited to see what else can we be able to, so we push that envelope harder to say that we can be able to offer Kenyans the opportunity not to travel out of the country. I think, to go back to your earlier question, what is the other advantage of some of the things we are doing now with the innovation is you don't have to leave the country to be able to go and do a procedure. You can have them right here. Yes,
fantastic. Thank you so much.
Thank you.
Dr. Michael Machiro, we really have had a good time. I learned so much, and I thought I had GERD, but after listening to everything you said, I do not have GERD. I just need to slow down on my eating and the timings that I'm eating. So it's been a very informative episode. Thank you so much. So anyone who wants to reach out to you, how do they get you?
Yeah, so we can give them a contact number for our clinic. I think I'll give it to you, or we can put it down. But usually they can call. They have them right here. It's usually 0722 628 564, and that we will book an appointment, have a clinic discussion, and then so we tailor the treatment to the patient, and so we'll discuss many things and then decide where we can do this. And I think it will be exciting to see the procedure itself very shortly, and that way you can be able to also see from the other side of this how we are able to offer this kind of care for patients.
Thank you so much, Doc.
Thank you.
And thank you, Glam Squad, for being with us. I've learned so many things, and I'm sure you have too. If you have any questions, please feel free to reach out. But I think my takeaway from today's episode is that, wellness is a holistic approach. You don't just look at what's in the outside, but also what is in the inside. So take care of yourself. If you need any help, there's a lot of people around us just ready to help. So don't just sit down and suffer silently. There's people that are ready to help you. So until next Wednesday, stay glam, and until then, mwah.
Just need you guys to do a mic check, please.
Mic check.
Mic on the mic. Yeah.
Reflux disease and hair disease. Wait. Gosh, let's just start from the beginning. Disease. I said disease.